We're going to transition a little bit. Now, remember, we've got all these things happening as we age. One of those is sun-damaged skin. If you do not have an IPL, that stands for intense pulse light, it is a foundation for facial rejuvenation. You have to have it if you're going to be rejuvenating faces. IPL is light that is filtered to treat dyschromias, discolorations in the skin. Now, because of the way that this is tuned, we have 25% more power on the new Lumecca Peak. It's the new handpiece on the new Optimus. And a couple different wavelengths, depending on what we're treating and where we're treating, in terms of dermal depths. And it's safe on all skin types. Of course, with darker skin types, you have to tune it down because it's looking for pigment in the skin, again. So just some before and afters. Again, if you do not have this, you need to have an IPL for appropriate facial rejuvenation. And I love IPLs. The reason why is very few things in my world do you get like that immediate result. You know, body tighten, surgery. Oh gosh, surgery. Everyone expects to be prancing around their bikini on Monday when they got their surgery on Friday. They're like 6 weeks later, they're so pissed off because the reality set in, like this is going to take a while to get to my result, right? And then there's a lot of things in our world that are like that. It just takes time. The thing I love about IPL is you smoke them that day with it. That night, they're sending you pics like, oh my gosh, look at all this sun damage that came to the surface. It's very tangible for your patients because what will happen is immediately after the treatment, this is immediate post, you will see it all pop to the surface. And then it subsequently flakes off. So there's no downtime. It's a little snappy when you get it, but there's social implications. So there's no downtime from a procedural standpoint. Doesn't hurt the next day. Maybe sort of the touch. But socially, you need to tell them, hey, you may be a little swollen. You're going to have these flakes that look like coffee grounds on your skin for 3 to 5 days. So there is social implications that you need to educate your patients on. But then look at what happens to the foundation. I mean, just a very clear foundation on the patient's skin picture right. Same thing here. Same thing here. Age spots. You guys get the point. Dyschromias, discolorations.